Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. It's been a few months since I've done one of these webcasts, one of these videos for the NAAOP membership and our friends. I wanted to thank Glenn Crumpton for his time serving as president of NAAOP, and that came to a close at the end of 2021, and welcome Maggie Balmer. Maggie is our new president, and we're very excited to be working together. There's been two O&P meetings thus far this year, and on behalf of NAAOP, I attended both. I've been working with the O&P Alliance as usual, and we're looking forward to another busy year defending, but also trying to advance orthotic and prosthetic policy. Let me start by saying that there's been two important regulations over the last couple of months that have been implemented by the Centers for Medicare and Medicaid Services. The first was issued on the 28th of December, and it was a long overdue regulation that essentially discussed how CMS will handle new technologies and assigning a benefit category to those technologies, and how they will determine pricing for those new technologies as well. Ultimately, we are hopeful that the new process that they're putting in place will work to the advantage of O&P practitioners, patients, and of course the manufacturers and innovators that bring new technologies to the marketplace and to the Medicare program to code them in the appropriate way. CMS ultimately is going to be relying on the HCPCS work group, which determines coding. HCPCS meaning Healthcare Common Procedure Coding System. They'll be relying on this group to determine whether a particular new technology is a orthosis, a prosthesis, or durable medical equipment. The big concern there is that if they determine that some devices that are in fact, say, a powered orthosis, but instead they determine that new technology is durable medical equipment, there will be added restrictions onto that new technology. They'll have to demonstrate, patients and providers will have to demonstrate that that technology or device is appropriate for use in the patient's home, which is a DME provision, a requirement, and that it very well may be paid on a rental basis as opposed to a lump sum basis. So it's an important decision. The second piece is, what do you price? How do you price a new technology once a new code is created? CMS is going to use the HCPCS work group to make both of those determinations, and that was unclear for the last 2-year period. We'll see how the new process works. We think on balance, it's better than the old process because it is more transparent. We will have an opportunity to see a preliminary decision from the work group and then respond, present witnesses, and we think overall on balance, it's a better system than currently exists. The second regulation involves prior authorization and the master list. CMS has added 6 new orthotic codes to prior authorization. Last year, CMS implemented prior authorization for some prosthetic codes, primarily fairly advanced components. My understanding is that that process has worked fairly well, despite some initial misgivings and concerns about the process. We do think, and we've heard from providers and suppliers that going through the prior authorization process is better. It's a better alternative than providing the care, getting paid, and then having those claims reopened, recouped, and waiting potentially years to get an administrative law judge opinion that the care was actually medically necessary. So we're looking forward to seeing how that new process plays out for these new orthotics that have been added to the prior authorization list. One big concern we have is that some of the same codes, some of the knee and back orthoses codes, are already exposed to competitive bidding. And the big question is, when a patient needs those orthoses at the point of care, it's an emergent situation, they can't be waiting a day or 2 or 3 for a prior authorization decision. We've raised this with CMS. We're working with our Alliance, O&P Alliance partners on this issue, and we hope to make progress on that soon. Finally, I want to talk a little bit about the NAAOP impending summer agenda. We will have 2 NAAOP Breece Fellows. The George and Dina Breece Fellowship will continue this year after a 2-year hiatus due to COVID-19. We're looking forward to welcoming Nikki Grace Strader and Lucas DeLuca, who will be here in Washington shadowing me for the summer, talking through with legislators, with agency staff, and trying to advance the O&P agenda. We'll also be hosting a virtual fly-in this summer and promoting the O&P Medicare Patient-Centered Care Act, key legislation we hope to achieve this year or as soon as possible to improve the situation for orthotic and prosthetic practitioners and particularly patients. So with that, let me say thank you so much for your membership in NAAOP in 2022, and we look forward to a really busy year. Thank you.